by the time we start picking the statistics up, we're at the back end of the equation where all the things we've tried haven't worked. But burnout, chronic fatigue, you just can't think positively about things. You're often associated with long hours or big hours where people just they're not even functioning at 60% of the best because they're just tired. Somebody once said to me, I knew I was getting towards burnout, Mike, because I was waking up tired. And we all know how important, especially I think as we all get a bit older, how important sleep is. And
how do you think? What I know you've talked about this professionally. How's good ways of managing it? What do you think some strategies for managing burnout are?
I think we've all got to take responsibility for our own health. I think first and foremost, and it's easy to say, oh well, it's just the job I've got, it's just the boss I've got, and I've said those things I think over the years, and especially when I look back to the formative years. So for me, the deal set off getting up at 5:30, and I go and hit the roads. I get out. I'm not a runner, but I live in the Dandenong foothills, so there's lots of hills to get up and down, and I'll do that, and I'll come back and I'll do 10 minutes meditation and 10 minutes yoga and stretches, and again, don't look good in a leotard. I call it yoga for not bendy people. And that's the start of the day, because I'll wake up and I've got work things in my head because that's how I'm wired. But that walk, and it's not, I think it was a bit of a chore for a while, and now I look forward to it. It's the basis for a good day. And then in terms of how I've managed my professional life, I try and compartmentalize things, and I'll put thresholds around things. And for quite a while, I had an alarm that would go off, and it didn't go off at 5 o'clock. It went off a little bit later into the evening, but that was the point where I was going to stop doing that thing and be home, Mike, and be here for my wife. And so it really, to me, I don't think there's a silver bullet that works for everybody, but for me, it was about a discipline of, I often say to people when I'm at speaking gigs, I'll ask people, how many people have brushed their teeth that morning? Everybody will put their hand up. How many people have meditated this morning? So we do help ourselves. We do look after ourselves, but it's got to be important, and we've got to understand why. And that comes back to the education. So, if I hadn't spoke to a doctor many years ago, and then, a counsellor back in the UK, and learnt, what are the things and the behaviours, not getting enough sleep, and all the things that I was doing wrong from a work point of view that weren't good for myself. I thought I was doing a great job for the company, but I wasn't doing a great job for Mike. So it really is getting some perspective and taking some responsibility around looking after yourself and looking after others as well, because community is a huge thing, and the solution for wellness in society is community. It's helping each other. It's asking, are you okay, and genuinely meaning it. You're not asking because it's a certain day where it's celebrated. It's just a normal conversation. I always challenge people and say, look, when you're wanting to redefine or improve the culture in your organization, think about the organization that you want your wife or your son or your daughter to work in, and aspire to that. Start working towards that, because it often gives people a different perspective when you personalize it to say, what would you want for the people that you love?
Gee, Mike, that's a great note for us to finish on. And if people wanting to find you, I know you're just moving into a new phase in your career.
I'm indeed, yeah.
Tell us a little bit about that.
So Mike Hagan Consulting Services, which oddly enough looks at holistic solutions to mental health in workplaces. So it's an area that was always part of my portfolio for many years, and it's an area that I just love working in. I've seen the negative impacts it can have on an organisation and an individual. I've experienced it, and the solutions aren't that hard. You just need to know what you need to apply in which area. You need to understand your own organisation first. So I've actually picked up a couple of clients where I'm working with them now to just do hold the mirror up and let's look at the organisation. Let's listen to the narrative that we use. Let's listen to the stories that we tell about ourselves. What do we celebrate? And if we're telling those platitudes or those stories about good old finance, that they work there 75 hours a week, and isn't it fantastic? No, it's not. And we need to stop talking about that. We need to stop talking. We need to fix the hours and the resources first. But we need to be careful about the culture that we, through the formal, the informal, and the individuals within the organisation, the culture that we develop. So I'm spending a lot of time around those conversations, and also helping organisations adapt to the oncoming legislation that you mentioned earlier on as well. So there's a lot to do out there. There's a lot of good can be done out there, and we need to do it.
Well, Mike, thank you so much for sharing your knowledge and wisdom with us here today. And thank you.
Thank you, Ron. Much appreciated.
Well, I think as we outlined there, I guess there are 4 reasons for companies and their leaders to engage in a proactive, positive workplace wellbeing initiatives. I mean, the return on investment financially is a no-brainer. There was a study done by Gallup about 10 years ago, and I'm sure it's even worse today. It was done with over 1 million people in 140 countries, and they interviewed millions of people. And what they found was that around 15% of those people were actively engaged in their jobs. About 65 to 70% were indifferent, and the balance were actually actively disengaged or sabotaging their work environment. So that's kind of alarming to think that something like over 80% of people are either indifferent or not engaged in their work. And that, of course, raises all sorts of issues about workload stresses, stress in the workplace, stress in life, burnout, which we've covered on several occasions recently with Clark Gaither and Sharon Grossman, and of course the wonderful Susie Green from the Positive Psychology Institute. So workplace well-being is part of life, and so this idea of a work-life balance seems a little bit old hat. A life balance seems to be what we should all be focusing on. And the positives about engaging in this are almost a no-brainer. I mean, as I was about to say, the return on investment financially, I mean, some estimates put it at for every $1 spent, there's a $6 return. I think that's probably conservative, but because these initiatives are not particularly costly, but the impact that they have is huge. So financially, there's that. Considering that at least a third of our lives is spent at work, and again, another poll done recently by the big HR firm UKG, which I referenced in the podcast, said that 70% of people interviewed said that their managers had as big an impact on their mental health as their own life partners, and a bigger impact than either their doctor or their therapist. So leaders are really at the core of this. And so we have the financial gain of doing something, the moral responsibility of doing something, and now there is a legal obligation to do something. And in Australia, the legislation is being rolled out, certainly on the east coast of Australia, New South Wales in October 2022, followed by Queensland and Victoria. I think the other states will follow. It's all built around an international standard called the ISO 45003. Which is being embraced globally. So the recognition that workplace well-being is an excellent opportunity to impact positively on people's lives is very real. It's interesting, too, that the Grattan Institute, which is a major research institute here in Australia, published a report in February 2023 just a few weeks or months ago, saying that Australia was sleepwalking to a healthcare disaster. And the reason it was because only 2 to 3% of our expenditure is on prevention. And that's a whole story about confusing and contradictory health messages, because health and food and the environment have become commodities. Our health has become a commodity. And while good health may make sense, it doesn't make dollars for the companies that are often behind many of the public health messages that we hear and the evidence-based marketing or medicine that is practiced. And this is a story that for most people is very easy to miss, but once you hear it, very difficult to ignore. So these initiatives are very positive. And finally, the biggest potential gain, because the paradox is that these very leaders that are being asked to deal with this very real and difficult problem are often the most stressed themselves. So the biggest payback here is not financial, it's not moral, it's not legal, it's in the potential health benefits to the very leaders themselves. So creating a better workplace is something I'm feeling particularly passionate about now and into the future.